topic, that is GOUT. It is disease of bones and joints. Here I will discuss about GOUT. Here main things highlighted, that is definition, etiology, sign and symptoms, pathophysiology and management of GOUT. First of all, definition of GOUT. GOUT is a common and complex form of arthritis. It's characterized by sudden, severe attack of pain, swelling, redness, and tenderness in one or more joints, most often in the big toe. The affected joint is hot, swollen, and so tender that even the weight of the bedsheet on it may seem intolerable. Suppose GOUT is affected in joint due to the accumulation of uric acid or formation of urate crystals. If GOUT is there, that location inflammation will occur, so that pain will be there, redness, and that site will be warm. These are some symptoms. And the normal uric acid in body in case of males, that is 4 to 8.6 mg per deciliter. In female, 3 to 5.9 mg per deciliter. But in urinary levels are normal below 750 mg per deciliter in 24 hours. If the urinary levels of uric acid is more than 750 mg per deciliter in 24 hours, it indicates that patient have GOUT. The etiology of GOUT means the risk factor associated with GOUT or cause of GOUT. That is maybe due to diet, alcohol consumption, some disease conditions like diabetes, obesity, metabolic syndrome, hyperparathyroidism, heart and kidney disease, and due to some drugs like thiazide diuretics, angiotensin converting enzyme inhibitors, beta blockers, and due to family history and age and sex. Mainly males are affected with GOUT than females, and due to some surgery and trauma, GOUT may be there. To know the sign and symptoms of GOUT, some sign like joint pain will be there, discomfort, inflammation and redness, swelling, that means movement. If one joint is affected with GOUT, that joints will be, there will be no movement. Stiffness will be there, stiffness. Complications of GOUT is there, like if GOUT is there, then severe degenerative arthritis. Rheumatoid arthritis, due to GOUT, severe degenerative arthritis, and secondary infection. There is a chances for secondary infection, urate nephropathy, kidney stone, fracture in joints, and depressions. These are some complications of GOUT. Pathophysiology of GOUT. This pathophysiology of GOUT is occurred due to the accumulation of uric acid. When uric acid excretion is decreased and then excess amounts of uric acid is there in circulation, that high level of uric acid is accumulated in joints, that uric acid forms crystals like urate crystals. These urate crystals accumulated in joint cause inflammation and deformation in joints. It leads to arthritis or GOUT. Next slide you can see. mechanism you can see that is formation of uric acid. Purine nucleotide is there. This purine nucleotide is converted to hypoxanthine, and from hypoxanthine xanthine is formed, and xanthine oxidase enzyme is there that is responsible for conversion of xanthine into uric acid. This uric acid should be excreted, urinary excretion, alimentary excretion, and if there is improper alimentary or urinary excretion, then tissue deposition in excess. The excess amounts of uric acid which is available in body, that will be deposited in tissues. Then this uric acid will form urate crystals, and this urate crystal will form microtrophy. It will be present in joints, and phagocytosis will occur, and after that phagocytosis, then acute inflammation and arthritis will be there, and it leads to GOUT. Management pharmacotherapy, you have to know the management of GOUT. Then some pharma drugs is used, mainly NSAIDs, non-steroidal anti-inflammatory drugs, colchicine and corticosteroids. And uricosurics is used like probenecid, sulfenpyrazone, and synthesis inhibitor like allopurinol, febuxostat is used. Here you can see the based on mechanism of action, that means NSAIDs, colchicine and corticosteroids is used for the treatment of GOUT, and these drugs prevent future attacks. That means these drugs is used to reduce the symptoms of GOUT, and it will prevent future attack. Means future, this drug will inhibit the formation of GOUT. And allopurinol and febuxostat also there, and these drugs block uric acid production. That means synthesis inhibitor. And again probenecid is there. This probenecid used for more excretion of uric acid from body. Non-drug management is there. In non-drug management, you should stop alcohol consumption, and you should take plenty of water. Weight loss, dietary changes, you should change this, and you should avoid foods which contain high purines like trout, anchovies, sardines, etc. And you should exercise regularly, that is walking, bicycling, swimming, and these things you have to follow. GOUT is a form of arthritis. True or false? True. GOUT is most often seen in men or women. Men. GOUT is caused by the buildup of what substance in the body? WBC, synovial fluid, uric acid, blood plasma. Uric acid is usually eliminated from the body by way of breathing, urine, metabolization in liver, sweat. Urine. Then symptoms of GOUT may include warm, severe pain, swelling in the joints, red and purple skin, peeling, itching skin at the site of GOUT. All of the above. Which one will be the true correct answer? All of the above. Then what is the most common site of GOUT attack? Big toe, foot, knee, ankle. That will be big toe. And what increase the patient risk for developing GOUT? Family history, high salt diets, asthma, all of the above. Family history. And which of the following is not a first line option for the pharmacological treatment of GOUT? NSAIDs, corticosteroids, oral colchicine, aspirin. See, everything, only aspirin is not associated with treatment of GOUT. Management pharmacotherapy, you have to know the management of gut. Then some pharma drugs is used, mainly NSAIDs, non-steroidal anti-inflammatory drugs, colchicine and corticosteroids. And urics is used like probenecid, sulfenpyrazone, and synthesis inhibitor like allopurinol, febuxoside.